Alright, so thank you for joining us today. Here again with another video. This time we're going to be doing some components of the cervical spine examination. So I will begin with some palpations of the cervical spine, the anterior structures. So the first thing I'm going to look at is the hyoid bone. It's located about the C3 vertebrae level on the anterior neck. You can locate this by asking the patient to do a swallowing motion, and you'll feel this bone move up and down as they perform that motion. The next palpation is moving directly down or inferior to that is the thyroid cartilage. And again, during the swallowing motion, you will feel this move up and down. And the last palpation in this area is again inferior, and it's the cricoid cartilage. It's the beginning of the esophagus here. So you can find that by palpating some bigger rings in the internal structures there. The next thing we'll move on to is again in the anterior, the carotid pulse. So you can locate that right lateral to the hyoid bone. And then you can also palpate the lymph nodes right under the jawline here on the side, just checking for if they're swollen, which would indicate some infection going on. And then the next palpation on the anterior side is the sternocleidomastoid. It's one of the bigger muscles of the cervical spine. So to find this more easily, you can ask the patient to rotate their head to one direction. And whichever direction they rotate to, on the other side, there will be a thin rope-like structure that comes out. That is the sternocleidomastoid, so you can easily see it pop out here. You can palpate along its length, just checking for any point tenderness or crepitus that may be existing there. And then the last musculature we will palpate on the anterior is the scalene muscles. So these are lateral to that sternocleidomastoid, and they insert on the collarbones here, but if you can palpate along their length up the neck as well. And then I will have the patient turn around for me to do some of the posterior structures of the cervical spine. So for girls, just getting their hair out of the way is a big thing. But I will start at the occiput, or the base of the skull, and that's the superior neutral line as well. And then from here you can palpate down the spinous processes. There will be 7 for the cervical spine. If you have them slightly flex their head forward, these will become more prominent to palpation. And the 2 that pop out the most are inferior is the T1, and then right above that will be the C7. So you can find C7 and palpate in a vertical line to palpate the rest of the spinous processes. And as you are palpating those, in between each one will be supraspinous ligaments that you can feel for any tenderness there. And then if you are on C1 and you palpate lateral, you'll be getting the transverse processes of the first cervical vertebrae. So those are spinous processes, supraspinous ligaments, the transverse process. The next thing we will do is the trapezius muscle. So this is the biggest posterior cervical muscle there is. You can start at the occiput here, and it will come down their neck on the lateral side and kind of insert on the lateral 1/3 of the collarbone. So if you follow that along there, it also runs here along medial to the scapula, so you can palpate in this general area for any tenderness. And one other musculature that you might be able to palpate, sometimes unidentifiable in patients, but it's the levator scapula. It's a vertical running muscle that is medial to the trapezius, and it lies beneath it. So if you can, you might be able to feel it, vertical structure there, but sometimes it gets covered up by the trap muscles. So I think that is the majority of the palpations that we will do for the cervical spine. So I'll ask the patient to turn around again so that I can lead them through some active range of motion for the cervical spine. So the first thing I'll ask the patient to do is bring their chin towards their neck as far as they can. This is cervical flexion. You're making sure that they don't have any compensatory muscle or movement in the shoulders. So keeping their shoulders level. and then you can ask them to put their head as far back as they can. That is cervical extension, and then come back to neutral. The next thing is lateral flexion, so to both sides, if you can bring your head towards your right shoulder, and then bring your head towards your left shoulder, checking for equality there, making sure it's a smooth movement. And then we have 2 more movements left. They are cervical rotation to right and left, so you can ask them to perform that. Looking all the way behind their shoulder as far as they can. That looks good. So that's the active range of motion for the cervical spine. And then I'll just perform 3 tests. So the first one is the Sperling's test. I'll have the patient where they are right now. And what I'm going to do is come behind them. I'm going to passively control their head. So I'll put my hand at the base of their skull. I'm first bringing them into cervical extension. And if there is no symptoms with this, I can add the next component, which is a lateral flexion. And if there is still no symptoms being produced there, you can apply an axial load down the cervical spine. And a positive for this test is that any of those movements, if it creates any neurological symptoms shooting down their arm, they probably have some nerve root impingement going on. The next special test that I'll perform is the cervical distraction test. So for this one, I'm going to have the patient lie down on the couch back here with their head hanging off the edge of the couch. And what I'm going to be doing is supporting their head and spine, and I'm going to be putting their head in a comfortable, slightly flexed position for the cervical spine. And I'm going to be grasping underneath the occiput and my hand on their forehead for stabilization and applying a distraction force. So I'm pulling their cervical spine towards me. And a positive for this test is if their symptoms are diminishing, meaning that when we apply that traction or distraction force, they are getting less symptoms, so they probably have some nerve root impingement going on there as well. The third test I'm going to perform is the vertebral artery test. So for this, it is all passive movements that I will be performing. So first, I will be putting their cervical spine into extension. So this one, I'm more stabilizing at the neck, allowing their head to fall back into extension. And I'm, during this test, watching their pupillary action. I'm going to have them have their eyes open for me. And then I will add in a rotation element. So bring their head into maximum cervical rotation. And you would hold this for 30 seconds. What you're looking for during this time is any nystagmus of the eyes. You're asking if they have any nausea, dizziness, a couple other trouble breathing. And so this would be the results of their vertebral artery getting occluded or being blocked off, so there's not enough blood supply getting to the brain, which is causing those neurological symptoms of dizziness, the eye involuntarily shaking, nystagmus. So that is the vertebral artery test. That concludes the testing for the cervical spine that I'm going to be performing today. So hopefully that is sufficient.